I'm Mark Pompe. I'm the Chief of Police here at the Washington Health System. We're here today to promote domestic violence awareness. Domestic violence is an issue that goes on 24 hours a day, 365 days a year. My many years in law enforcement, I have encountered numerous domestic violence calls. We are trained as officers, well trained in the county, to recognize signs of abuse. Not only are our police officers highly qualified to recognize signs of domestic violence, but also our nurses and doctors. Everything is kept confidential, and if you need to report or you know someone that is experiencing domestic violence, please let us know. This is a safe place, and I'd rather you come here than keep going through the abuse that you're dealing with. Here at the Washington Health System, we have partnered up with Domestic Violence Services of Southwestern Pennsylvania. Here to explain more is my good friend Leslie Orbin.
Hi, I'm Leslie Orbin. I'm Communications Specialist with Domestic Violence Services of Southwestern Pennsylvania. A lot of times when people think of domestic violence, their minds immediately go to physical abuse. And while that's certainly the case a lot of times, domestic violence can encompass far more than physical violence. Emotional abuse, verbal abuse, digital abuse, sexual abuse, financial abuse. These are all fall under the umbrella of domestic violence and are all considered abuse. Domestic violence is a lot more common than people think. Our statistics show that 1 in 4 women and 1 in 7 men will experience domestic violence during their lifetime. Oftentimes, domestic violence is hidden behind closed doors. It's something that's considered a family issue or something that people like to keep private. So a lot of times the statistics are underreported as far as actual cases of domestic violence where people are either seen in a hospital or are referred to a safe house. So it is dramatically underreported for that reason. You know, oftentimes a lot of the warning signs of domestic violence remain hidden. Physical abuse, sometimes the signs are obvious, you know, bruises, broken bones, things like that. If somebody's experiencing emotional abuse, financial abuse, or some of the other types of abuse, you might look for things like anxiety, canceling appointments at the last minute, not being able to show up to work or school on time, or often canceling at the last minute. If somebody's in a relationship where their actions are being controlled by another person, they might not be reliable because their actions are being controlled. The short-term effects are pretty powerful as far as the injuries that you might see. But the long-term effects, a lot of people don't realize how many long-term effects there are for survivors of domestic violence. Not only for the people that are experiencing domestic violence firsthand, but for the children that witness the abusive behavior going on in the home. For survivors of domestic violence, they can experience traumatic brain injuries, they can have long-term anxiety or mental health issues. The studies have shown that children that grow up in a household where domestic violence is present are often more at risk for serious long-term health problems, including obesity, depression, anxiety. They're more likely to abuse alcohol and drugs as adults. They're also more likely to either be a survivor of domestic violence or a perpetrator of domestic violence in the future, because they've witnessed that type of behavior in the home, they feel that it is normal, and they continue the pattern of abuse as adults. Sometimes it's very difficult for somebody experiencing domestic violence to leave the relationship. It's easy for somebody outside the relationship to look and say, well, why doesn't the person just leave? But it's a lot of times it's a lot more complicated than that. There might be children involved in the relationship. There might be financial difficulties for the survivor to leave the relationship. Either their finances are being controlled by their partner, they're not allowed to work, they might have an allowance, there might be significant barriers financially to somebody leaving the relationship. There may be, there's a stigma attached with domestic violence a lot of times. People might feel ashamed to admit to their friends or family members that they're experiencing domestic violence in their relationship. So oftentimes that is a huge barrier to leaving. Family pressures might dictate that we keep the family together for the sake of the children or for the sake of the relationship, to not bringing any shame upon the family. Pressures like that are a significant reason why a lot of people choose to stay in a domestic violence relationship. It's often a lot more complicated than people think. October is Domestic Violence Awareness Month, and this year's theme is Everyone Knows Someone. which goes back to the statistics about 1 in 4 women and 1 in 7 men will experience domestic violence in their lifetime. So the chances are that you do know somebody in your community, at school, at work, in your family that might be experiencing domestic violence. DVSSP is so grateful for the partnership that we have with the Washington Health System and other organizations in the community that can help us raise awareness of domestic violence in October and throughout the year, and help get survivors in the community connected to the resources to help them. We provide trainings and outreach programs to local law enforcement as well as folks at the courthouse and to the community in general to help raise awareness of domestic violence and help get the survivors the resources that they need to help. At DVSSP, we believe that nobody deserves to suffer abuse in their relationship. And we want everybody to know that there is help available if you might be experiencing abuse at home. Our 24/7 hotline is available 24 hours a day, 7 days a week at 800-791-4000. And that number is available to anybody that might be experiencing abuse themselves or is concerned about a friend or family member that might be experiencing abuse in their relationship. There is help available.